This is a huge issue, and it's been even a bigger issue post-COVID. Female hair loss, what's called female pattern hair loss, or FPHL, ongoing higher levels of polyamines in our systems is equated to better health. Countries that have diets with higher levels of the polyamines, like spermidine and putrescine, like Greece, places like that, have better longevity, have less dementia. Metformin, however, has the downside of potentially
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
So first question comes from Melissa, who is from Wyoming. And Melissa, who has seen me for some arthritis and is been on Pentacin for arthritis, and she's been taking it for several months, is noticing significant benefits. She says she likes the way her muscles are feeling, her energy is better, her joints have improved on Pentacin, but that she's a bit heavier than she was despite following a very strict, healthy diet. And she's wondering if the Pentacin contributed at all. Well, I haven't heard that. I use Pentacin a lot in my practice, so a real lot, and then myself. I have not heard anybody complaining about weight loss or weight gain. I did actually look through a lot of data online to see if I could find any, and there are side effects, very remote side effects that people have talked about weight gain and weight loss with Pentacin. I suspect it's probably more incidental to than due to, because the mechanism doesn't really, there's not a lot of ways to explain weight gain with Pentacin. It's very anti-inflammatory. It tends to be the anti-inflammatory things tend to mean more contribute to weight loss. When we're in inflammation, we gain weight. So I suspect that that it's probably not related unless you're putting on some muscle. So that's a possibility. As we reduce inflammatory markers, we can put on muscle more easily. So it's possible if you're just weighing yourself, that you are putting on some muscle. You don't know that unless you have a scale that's really measuring that. So I encourage you to look at that. But I would also, look at, is there anything else that could be contributing to that? And then, if that continues to be an issue, looking at other things that we can add into the regime. One of the things I always sort of tout in weight loss, because I know people get a lot of, weight loss is so hard, and people get a lot of, oh, you must just not be eating right or not exercising enough. And I think there's much more complexity of weight loss, and there's a lot of roads to go down in terms of helping people with weight loss. So those of you who are struggling with weight loss and are just, you feel like you're eating perfectly and you're exercising perfectly and you're still not losing weight, there truly is people who really need more help, and you can't be adverse to sometimes using medications and peptides and things like that to help with weight loss. So I'll use this also as a little bit of a jumping point to, please don't be discouraged by a lot of physicians I know who just say, you've got to eat better, because that's not always the case. And lots of times we have to use a lot of other techniques, things that improve metabolism, drugs like semaglutide or peptides like semaglutide that are really helpful for weight loss. And that's not being defeatist and saying you're not eating right. Obviously you have to eat right and exercise, but a lot of people need more help than that. And it's not, it's not a failure if you've failed the realm of weight loss from that perspective and need some help. Please contact us for that kind of purpose too. And also jump off on saying that, and we'll put a link in there, a little mini lecture on weight loss that I did. We'll put a link to that, the Academy, that you guys can go watch too, because there's a lot of cool things with weight loss. And also just use this as a jumping point to, Pentacin is one of my favorite drugs. I've been on it for years. It's the longer you're on it, the more benefit you get on it. We really see such improvement with this drug with those of you who are suffering with joint pain, back pain, arthritis. It really can be quite dramatic. Sometimes you have to be patient with it. David asks, how do you feel about using a peptide like CJC 1295 to boost muscle strength after suffering an injury or having surgery? Great question, David, because we love helping our patients with peptides after surgery and after injuries. It's super important. So what do you want after surgery or after injury? You want more of the anabolic state. You want to rebuild, right? You want to rebuild muscle, you want to rebuild bone, you want good mitochondrial activity. So what do? Growth hormone secretagogues. You want the growth hormone secretagogues because those are going to increase IGF. Your muscles need IGF, so you're going to help heal faster. So yes, usually CJC, which those of you guys who don't know about it, CJC, oftentimes used with ipamorelin, are growth. So CJC is a growth hormone releasing hormone. It tells your pituitary to release more growth hormone. And then the ipamorelin is a growth hormone releasing peptide. Used together, They have a nice synergistic effect, and you produce and release more growth hormone. So we have you use those usually if you're recovering from an injury. We'll have them use kind of twice a day or even 3 times a day, but at least at night when you're doing your most sort of rejuvenation while you're sleeping at night. So I love those two. And then lots of times we throw other things into the mix, right? Because if we're really trying to heal you, what else do we want? We want more of an anabolic state. So we use things like nandrolone. Nandrolone is it's an anabolic agent. So like testosterone, but whereas testosterone is a 1-to-1 ratio of anabolic, muscle building, androgenic, everything else you think about guys, sex drive and all that kind of stuff. That's all androgenic, anabolic muscle. So 1-to-1 for testosterone. For nandrolone, it's 12-to-1 anabolic to androgenic. So you get much more muscle building effect from it. And we put people on that for a short time after injuries or after surgery to enhance recovery. And then using other peptides like BPC 157, thymosin beta 4, that encourage collagen tendon function. So that combination can be super incredibly wonderful for healing and recovery. And then sometimes using platelets and things like that as well. So we love working with that group of people because honestly, one of the surgeons that we used to work with a lot at my old practice also is, he would send patients over here and was always just remarkably amazed how well people did with that treatment, healing 3-4 times as fast. After joint replacements, it's great, things like that. Is it safe to start hormone replacement in women 10 years after menopause? I know in the literature, this is a really hotly kind of debated thing. And I think, number one, my answer is the earlier studies are all showing that the earlier you can start replacing hormones. So before menopause, so when hormones start dropping before menopause, your perimenopause period can be 10 years before menopause, meaning your period stops. That you want to start earlier replacing hormones. The earlier, the better. A really good cardiovascular study came out of Stanford that showed the women who started hormone replacement earlier had much, much less heart disease. So I would say early is better. Is it ever too late? No. In fact, a study I think really recently came out on dementia, and it showed that women even starting later with hormone replacement had a 58% lower risk of Alzheimer's disease and other neurodegenerative conditions. So my answer is I don't think it's ever too late to start, but if you're still a younger woman, start early because that's going to have more beneficial benefits. Okay, Patrice, who's from New York, asks about whether I cycle spermidine. So here's my 2 cents on that. I think that we know that ongoing higher levels of polyamines in our systems is equated to better health and better longevity. Countries that have diets with higher levels of the polyamines like spermidine and spermine and putrescine, like Greece, places like that, have better longevity, have less dementia. So we know that higher levels of polyamines are good. It's hard to get polyamines from our diet in a satisfactory fashion anymore. They basically degrade with food transport and things like that. So I recommend that everybody take at least a low level of the polyamine spermidine on a regular basis. So like 1-2 caps a day on a regular basis, whatever you can afford. 2 is ideal. And then what I do is I cycle more of a detox type dosing. So I'll cycle quarterly a 6 micrograms. So 2 caps is 1 microgram. It's actually 1.2 micrograms. But then I'll cycle with a 6 micrograms. So we have this pro version that's a higher dose of spermidine. And I'll cycle that quarterly. It's these little sachet packets, so you can just drink it down. And I'll do that quarterly for a month. So I'll cycle the very high dose, really autophagy inducing, right? So doing a big kind of clean out of my bad cells using this high autophagy inducing dose. I'll cycle that, but I'll use a maintenance dose on a regular basis. I honestly think you need a higher dose than the baseline dose to really induce high level autophagy. So if you're really looking at a senolytic agent, I think you have to use higher dose. None of us could afford that long term, nor is it good for you to do that continuously. So just like any of the senolytic agents, like rapamycin or fisetin, all of those should be cycled, either done on a weekly basis or once a month or quarterly, whatever it might be, depending on the substance you're using. So that's the way I use spermidine, and that's why I recommend it to my clients who can. The big downside there again is cost. When it becomes cost prohibitive, it's just an expensive supplement, like a lot of these are, as you know. So Donna asks about hair health for women. potential causes of hair loss, thinning, and what we can do to mitigate this. This is a huge issue, and it's been even a bigger issue post-COVID. We're not quite sure why, but there's been a mass of hair loss post-COVID, both in people who had COVID, but even people who didn't. And people sort of surmise it's the stress. I think there's something more to that. Maybe there's some low-grade infections that have occurred in people. But female hair loss, what's called female pattern hair loss, or FPHL, is basically this kind of progressive thinning of the hair and a decrease in the number of hairs, especially kind of frontal, sort of central. And what really seems to happen is that there's actually a change in the hair follicle itself. So the hair follicle changes from this. Most hair follicles are kind of big; they're sort of larger and thicker, and they change to these very short, tiny, thin hair follicles. So now the hair that grows is really fine and really thin. So it's very sparse, right? So you're actually not losing the hair follicles. They're just changing in function. So you diffusely see this change in the hair that's much, much finer and thinner. And so you look at this, you'll see these kind of bald looking spots, throughout. It's just this thinner. That's why women say that, yeah, my hair just seems thinner. And when you have pull on your hair, you'll find that it'll come out with like little small pieces, little short pieces. And that's because these hairs they're not as deep rooted. So they pull out more easily and they're kind of small and thin. And so there's been a lot of studies about this FPHL, the female pattern hair loss. And we know there's a lot of play into it. It's probably genetics play a big role. Hormonal and environmental factors play a key role. And so there's a lot of kind of people researching it because it's becoming more of a problem. I think that one of the issues is that you want to, first of all, make sure that simple stuff's done, right? Have you balanced hormones? Is thyroid normal? Meaning you're free.